What are the challenges in our healthcare system in India? So, challenges. So, these are the key growth inhibitors. Growth inhibitor means preventer. They prevent our growth or delays our growth, always suppresses our growth. What are these? These qualitative healthcare. Healthcare can be quantitative. I have read 10 chapters, but no one in no chapters I am very much well versed. That is not. One or two subjects. For this reason, this is the era of specialization. Everybody wants to become a specialist. MBBS, general doctor. So, after that you become specialist. So, every subject is qualitative. So, qualitative means, qualitative service is prevented by the following things. Fastest growing population. I will tell one by one. Changing disease profile and re-emerging of diseases, multi-layered health care system and landscape, lack or absence of infrastructure, prosody means lack of numbers of manpower, doctors, nurses and paramedics, extremely low public expenditure on health care and its inaccessibility of health care service. So, one by one I will tell, fastest growing population. So, most populous country in the world is now India. India population is 142 point like that crore, 142 crore, and China is lacking behind. So, area wise, USA is 3 times bigger than India. Population is 35 crore. So, all countries, so much population is there, handle the population, problems of different states are different. Not only health problems, there are problems of infrastructure development, road development, water sanitation development, water sanitation supply so many people. Everywhere there is a problem. Linguistic, racial problems, so many problems. The more people more. In your own family also, more children, more problems. So, one children, less problem. Nowadays, one children also causing more problem. So, you see, these are the most popular stations in the earth. Estimated population 2023 also I have given. So, urban-rural population division. You see, urbanization is very fast nowadays. Urban making cities. City life, people want to go to city. Everybody in our state also, everybody, you see many of us has got a house. All have got a house in Dharmanagar, Wilashwar, but another flat over here or house. In urban area also, or if they have got a house at a remote place, they make a house in the urban area like Bironia, Sabru, local district. So, urbanization, population, rural population has got, urban, how much it will increase? So, up to 2050, urbanization will be very much high. Increase of rural and urban will be same. So, you see, urban population increases. The day we are passing, many forests and jungles are abolished and new urban area is set up. So, that also creates an imbalance in atmosphere. So, all the animals are killed, all the trees are cut down. So, there is the day are going up. Previously in 1950, this is you see, this is the rural population. Urban very less. So, gradually increasing. Urban is increasing, rural is also. So, at 2050, it has become equal. It is estimated. So, the more the urbanization, the more the problem in the urban areas. So, India, which makes 16.5% of the world's population and faces a significant burden of disease. It accounts a third of diarrheal disease. It is the hub of tuberculosis. So, respiratory disease, parasitic infestations, and prenatal condition also precarious. a quarter of maternal ailments, many maternal. You see, we have to face many problems. India has got so many countries of the world. There is no malaria in USA, no mosquito. No mosquito, you will not find any insect inside your room. Or a very clean, or there is more mosquito, no mosquito is there. And mosquito net is also not available. But here we have got so many, every year many people are dying of malaria. Not only here, Pakistan, African countries also. So second largest number of HIV and AIDS disease in the world here now in India. So fifth of nutritional deficiency. Here in Tripura, if you think, we have got less nutritional diseases but in many states of our country, people living below the poverty line, they are suffering from kwashiorkor and marasmus. These are the nutritional diseases, malnutrition, anemia. So nutritional anemia also very common. So there is a non-communicable disease burden in India. Non-communicable means some disease goes from one person to one person, that is called communicable disease. Diarrheal disease, tuberculosis, so these are the communicable disease. But non-communicable like cardiac disease, very much increased, 50 million patients are there. 50 million means 5 crores. So diabetes is increasing very much. Diabetes is increasing not due to only food, but it is stress in our life, working place life, and also nutrition. Over maximum people who are overweight due to heavy nutrition. So cancer is increasing due to many factors, multiple factors are there, and one of the factors is atmospheric pollution and smoking. These are the stroke. Stroke is a consequence of hypertension. So hypertension is a consequence of stress, which causes again diabetes, stroke, and cancer disease. Once 1 hour in our time, there was a disease called syphilis. If we knew syphilis, you know everything. Syphilis is the disease which affects all the system of the body. Very early stage, in 1970s and 80s. Now, because syphilis attacks coronary system, heart, brain, neurosyphilis, from skin, all systems are affected. But nowadays, it is diabetes. Diabetes, you read diabetes well, you know a physician, full physician. Because diabetes, so many complications, food complication, heart complication, stroke, everything, eye complication. So kidney, everything is affected by diabetes. So, and renal complications, renal transplants, 1,75,000 transplants are required every year. So cardiac, diabetes, cancer, stroke, and renal. So burden of disease, non-communicable burden of disease is gradually increasing. So many cancers. Now we have got a very big cancer hospital in Tripura. It was not earlier there. So cancer hospital, once you visit, you will be astonished to see. You will have very pain. You will feel. You will be very sympathetic. Even so, so many people are lying on the floor also. So, multi-layered healthcare system is second. So, we have got a healthcare, level 1 community centers, means in very remote village areas, so there is a community center where people gather, meetings, there is multi-layered level 1 community centers. Here also, sometimes doctors goes, pharmacist goes, or all the community people gathers and get some help from the health care advisors. So, level 2, dispensaries. Dispensaries are there in a remote villages. So, there may be some, earlier there was only pharmacist. It was run by a pharmacist. So, nowadays, as the doctors' number increased and dispensary are also, some dispensary also, doctors are being posted in some dispensary and they are giving service. And the population will 5,000 around. This. Level 3, PSC, Primary Health Center. and above this there is rural hospital also. Then level for district and sub-divisional hospital. Udaipur district hospital, Dharmanagar sub-divisional hospital, like that. All districts, we have got 8 districts, district hospital and sub-divisional hospitals. Level 5 provincial hospital, provincial hospital like IGM hospital, TMC, Tripura Medical College, referral hospital, national referral hospital like AIMS. AIMS, every state has got AIMS nowadays, 22 AIMS, there in many states. So, the multi-layer healthcare system is the problem. So, patient gets sick, where they will go? Directly they will go to district level, it is a long distance from there. So, it is but level 1 community center, there is no such facility. Doctors per 1,000 people. So, Germany has got 4.3. So, Russia 4.1 per 1,000 population. India 0.74. So, you see, the number of doctors is very less in India. Still, for this so many medical colleges are being established in private sector also to fulfill the demand. But the distribution of doctors is less in rural and urban areas. Many of the doctors who did not want to go to village area, would not, because many facilities are also not there and reluctant to work. In earlier days, you have seen many pictures of the cinemas also. FRCS, MRCB doctor, well trained from USA, they have to go to villages to give service to people. Nowadays, people are not going. At that time, many students used to come from a lower economic group or middle economic group, middle class family. Nowadays, maximum people are coming, if students are coming from high economic zone. So, and also we are, so much facility we have built in our family life also, we don't want to go to village to serve the people. Our aim is also changes, our facility changes, everything is changed. So, this rural and urban doctor discrepancy, number of doctors discrepancy also creates a problem in India. So, number of doctors in fact in India less in comparison to Germany, Russia and Italy. So, inaccessibility of healthcare service in India. Number 1, physically reach. Physical reach and accessibility. Means your hospital is not reachable by you. Means a hospital is situated like in a remote place, but people are remaining 5 kilometers away, 6 kilometers away, big village. So, there is a person who is remaining 6 kilometers away from this place, hospital, they cannot reach to the hospital in time, or they are reluctant to come to the hospital because communication is not good. Hilly areas. So, reluctant to come. So, inaccessibility, this is, the area is very difficult. Outpatient is important. Then, availability and capacity means ability of the previous healthcare resource person. Doctors cannot be available for patient. Doctors, nurses, inpatient bed, diagnostic sample is not available in their hospital. So, this is also a factor. So, location of the hospital, a bit distance, and also facility also not available. Quality of the doctors and functionality means quality of healthcare resources. As for example, she has got some disease or he has got some gynecological disease or orthopedic disease. So, one doctor is there, MBBS, he will, what he will do, he has got no facility, no instrument, nothing, he will refer the case to a higher center. So, facility is not also available and the quality of the doctor is also not good. And last is affordability. You have, the person has come, you have given some medicine which is very costly. Key person say physically reach, distance of the hospital, a bit away from your place, or availability and capacity of bed nahi, nurse nahi, doctor nahi, nothing is there. So, facility is not there. Quality and functionality, functioning Many times you go to the peripheral area, doctor साहब घर में गया ताला लगा के चला गया बस doctor patient went. I've seen many like that, many dispensaries. So doctors are gone home because he is there for months, so he has gone for 2 weeks at Agra. Bas. So it is closed. So affordability, the cost of medicine is very much, or whatever is there. So you that is also a problem. So why that is? Healthcare challenges in India. India has a low level of government spending on healthcare. Only 1% of GDP. Only 1% of GDP you are spending on healthcare. Because health infrastructure is poor compared to urban areas. In rural areas, in urban areas, very big hospitals. AGM, IEM hospital, GBS hospital, TMC, Apollo, Fortis, Medicare. So many hospitals. All are in the center, urban area. Rural area. So everything, so that is the distribution of healthcare infrastructure is poor in compared to urban areas. Limited healthcare is a low priority when it comes to the income allocation. And with average consumer expenditure on health of 75%, 7%, 80% of the rural population is on a daily wage. So you go to college, you see, whenever you have gone to Bartola, you will see around that banyan tree, Bodgas, Shonitola, so many people they are waiting for labor, daily labor. So they are 500 rupees, 600 rupees per day, very low cost labor. So by that they have to maintain their family also, they have to spend on their health care also. So some ailment is there, they cannot purchase high cost medicine. So affordability is very important. If they go to a private sector doctor's fees is also high. So if they go there, they will give doctor's fees, they have to give an X-ray investigation, then they have to purchase medicine. From where they will get money? They are very low. So they have to attend a hospital in rural area where the facility are also not available. They are being referred to a central urban hospital, and if they go to urban hospital, use rush, use chaos, there also everybody is writing high cost medicine. So affordability is very difficult. So people are very poor. Only the healthcare at just 7%, 80% of the rural population. 7% spending on rural, 80% population. So low awareness of disease and possible treatment. So people are not aware of disease. Oh, they have got some diarrheal disease. It will be cured, no problem. 3 days, 4 days, after 4 days he dies. Diarrhea disease or some other disease, they are not aware of the disease. Malaria, bukar ho gaya, there is some fever. So they neglect. It is low fever will become paracetamol they are giving. Fever coming, fever going, fever coming. But they are suffering from other disease like malaria, maybe typhoid. So that will be causing some complications and patient will succumb to death, lack of awareness. And also treatment, about the treatment, they are not aware of it. Poor basic hygiene and living conditions. Though this condition is improved in rural areas nowadays, if you go in our time, poor hygiene condition, Bosti onek chilo, ekshomay, slum areas. So nowadays it has been improved, though, but still 33% of the diseases in rural areas are related to the unsafe drinking water. Drinking water we are not saving. In urban area it is available, but rural area it is not available. In urban area also many times, many flats and buildings it is not available. You have to go to the road, bring some drinking water from the tap. So this is very important. Government reviews the findings. So major legislative gaps is there and poor implementation of the laws and policies. So these are very important. Lack of uniform standard. There is also non-coverage of laboratories and diagnostic centers. So there are many standard healthcare treatment protocols are not given, and laboratories are here one laboratory, there is another laboratory, and the persons who are doing the blood test and other, they are not well trained or they do not know many things. and they are not well licensed. Legal things are not taken, legal action are not taken. So, initiative by government is taken, rural-urban difference, developing more equitable healthcare infrastructure between urban and rural areas, convert primary health centers into community health centers. So, these are rural health centers. So, government is trying to rural-urban difference, how it can be elevated, health resource and infrastructure. So, we are trying to meet up the health sector as per global standard, improving the critical care facilities and high proportion of our pocket relevance, affordability. How can you increasing the minimum wage? Government is trying to increase the minimum wage of the laborers. So quality improving because many medical college licenses given, public MBBS, they are producing more MBBS, more MDCs. India 0.9. Doctors বলেছিলাম 0.74 total doctor. Physician means MD medicine. So physicians India is 0.9, while Russia is 4.2 per thousand population. Among these countries, the highest number is in Russia. Global average is 6.2. They are growing down the global average also. Average, WHO has given the average is 6.2 physicians per thousand population, but India is 0.9, not even 1 physician per thousand population. Next slide. But nurses population per thousand, India is 1.96, China 4, Brazil 5.5. This should be nurse. Normally, nurse should be in day duty, in bedded hospital. Every 4 bed should have 1 nurse during daytime. In night time, it should be every 7 bed 1 nurse. But in our wards, if you go to even a GMC, I was there. So there are 2 sisters are doing duty for 50 bed. So there should be at least 12 sisters, but there are only 2 or 3. So the next slide. It is key slide. Hospital beds, global average 4.3, India is 0.5, 0.6, India is 0.6. ठीक है, global average 4.3 and 7.3 is Russia. Russia is highest. Russia and Japan. Japan is 12. So per thousand population, bed in Japan more than 12. India is 0.5, 0.6. So average is 4.3. In this 2019, কালিগুলো যে কি দিয়েছিল আরে দেখা যাচ্ছে না। নেক্সট, তারপর স্লাইডটা লাইফ এক্সপেক্টেন্সি অ্যাট বার্থ। জাপান অ্যাভারেজ লাইফ এক্সপেক্টেন্সি ইজ 85.2. Life expectancy depends on your, not only on nutrition, your food habit, also your environment. So life expectancy in India is 67.24 as per 21. Global average is 71.3. China, Russia, Brazil, you see. So all countries are ahead of India. Malaysia is also better than. So prepare yourself for death by 70. Or increase yourself your age of life by giving good habit and grow good habit. Next. তারপরটা in life expectancy of neighboring countries like Bangladesh 75.2, India 67.24 by 24. This two, Pakistan is 67.9. So our neighbors also you see, their life expectancy of people are more than India. This is Asia average is 74.37. Next slide. So infant mortality rate is the rate by which whether the country is developed or not, it is measured by infant mortality. Infant mortality below 1 year, Japan 1.6, India is 25.79 per thousand birth. Mane the children, the infant born this year By next year, 25.79, but 26 children will not see their second birthday. They will die. Infant mortality. So Russia, Japan is 1.6 only. Russia 4.6, China 8.16, USA 5.6, UK 3.9, Brazil 10.2, India 25. Malaysia is 6.8. I have given Malaysia intentionally because it is a neighboring country. So global average 29 is like, nowadays global average is like this in 2018. Next slide. So under 5 mortality by 1000, it is a 221, though it is written, but some are, these are recent updates. Bangladesh is 21.55, earlier it was very high. India is 25.79 now. So next, this is our neighboring countries have given. So next, so maternal mortality rate per lakh population. Maternal mortality rate per lakh. So maternal mortality occurs prenatal, antenatal and postnatal. Prenatal means before birth, after birth, during birth and after birth. So India is 97 per lakh population, where Bangladesh 74.9, Sri Lanka 29. So all countries level is very high. So these are the things we want to improve our health status, health structure by improving this one. Next, waste disposal. Waste disposal is nowadays improved in our hospital waste management. Is their team is there, and there is no effective tribunal. There is not also correct tribunal is there. If there is a negligence from the doctors, there is a court case and court settles the compensation. Many doctors lost their licenses and they have to give compensation also. Major challenges. According to the paper, a National Medical Journal, 75% violence against doctors is verbal, including intimidation and threats. Workplace violence is most dangerous. Recently, we have got a workplace, one of our doctors were killed and murdered in hospital. You see, workplace violence is it is not only the fault of the doctors, but there are, I will tell why the workplace violence is more. Often patients and their relatives turn to violence because the healthcare system has not met their expectation. You think we are not God. We cannot give life to anybody. But we can try to improve the health. And the way there may be lack of infrastructure, there may be lack of facility, lack of manpower, and you are overburdened. At a time, 3 patients, 4 patients came in the rush to the emergency and you are only one doctor. So you cannot concentrate on everybody. Somebody dies, you will be mishandled, you will be beaten. So that is not your fault. So lack of manpower is a problem, lack of facility. X-ray facility is not there, other things in district hospital, sub-division hospital is not there, X-ray machine is there, machine is out of order. So at that time, what will happen? They will become violent. Why it is not there? So there are many factors for which doctor himself. Or sometimes you are so much overburdened, you misbehave with somebody. You are tired, you cannot do. You cannot handle all the patients together at a time. Or you are very much irritated. So at that time they will not understand. They are busy with their own problems. So some perpetrators become violent over the corners of the patient condition, such as the actual or perceived deterioration of their condition about doubt. Psychological impact, some immense psychological impact. Because one patient dies, there is immense psychological problem on their parents or their children. So that is also a problem. And there are, after experiencing violence, doctors wish to stop offering emergency services, refer patients sooner to more specialists. That is handles when you are mishandled, your colleague will come and refer all the cases to this. Go, everybody will go. So that is also a problem. So strengthen, how to eliminate it? Eliminate this threat, we must spend more money to strengthen the system. The money not from your pocket, this is government budget. The budget allocation is only 1% of your health, very less. So all facilities government cannot give. And beds are not, whatever bed is there, bed is also not sufficient. I've shown you the bed strength also very less. After the West Bengal incident, the central government has declared that it will form a high-level committee with the 2029 bill available in Parliament for making the Central Act of Protection of Healthcare Workers. Until a central law becomes reality, the state-level reforms represent significant. So, law is there sometimes. There are some people politically motivated or psychologically upset. They will make chaos. There are some people born for making chaos. Not all the people, some people are there, they will stand somewhere and they will start making chaos. So, personal experience, issuance of medical certificate, this is my personal experience. So, I will tell you some experience. A doctor after passing out, patient will come to you to give me a medical certificate. So, never give a certificate, patient will tell that, sir, last 7 days I could not, but last month I could not, in last April I could not go to office. I was busy, you have given, but you have not marked, never given, because it happened like that. In the last April he was in jail. Jail custody, he might have done something wrong, but you have given, he was under my treatment for this from this period. So never issue a backdated certificate. Or, I've got a bad experience. When I joined the service, very early in 1984, I was posted in a PSC, in a dispensary, very remote. So I was the first doctor of the dispensary. সব কিছু রেকর্ড করিস না, এগুলো আমার এক্সপিরিয়েন্সটা বলি আর কি। So I was posted in a dispensary. I was the first doctor. So there was a police camp there. So every day, evening time, patients attendance very less. 10, 15 like that. So we used to see they are playing volleyball in my area. Field volleyball they are playing. So I saw one person, he is playing volleyball there. So after 1 month, his wife came to me, please doctor issue me a certificate, my husband is sick. Then I told yes, last few days he is not coming. Why he has become sick? Okay, I have given a certificate. Like he is under my treatment, I did not know. So this is my experience. I am telling you, you must be careful. After giving the certificate, not even a month, a letter came to chief medical officer that your doctor has given a certificate to a person who left military camp with guns. He is giving teaching or something to Ugravadi. At that time, TNB was very active. ও বন্দুক ফন্দুক নিয়ে পালিয়ে এসে গ্রামে উগ্রবাদী। Why the doctor would not be suspended for this false medical certificate? That's correct. I did not know. Then CMO called me. You have given the certificate? I told yes, sir. You have not seen, you have, yes sir, I have seen, he is playing, but he is not coming. His wife came, I told the truth. Then he told, without asking, he is like this. And then, sir, what will happen? Well, you will be suspended. Well, all right, you suspend me. I was at that time very young. So I told that, if you suspend me, sir, very good. I will go back to my own place. I was doing house job in Kolkata, PGI, at that time, and preparing for PG. I will do PE, I will go. I will not do any service. Fortunately enough, he did something so that my service retained. Number one. This is one incident, backdated certificate, never issued. Second, I was in a PSC after 5 years, 6 years after that incident. One patient came. He was a diabetic patient. He used to serve in Silchar. This is the real incident of my life. So, he was a patient, so he was admitted in my hospital. He was a brother-in-law of a doctor. He told, I am the brother-in-law of that doctor. Achha. After discharge, he came to me. So he came to me, give me a medical certificate. I have got a soft corner because he was admitted also, and he is also brother-in-law of doctor. So doctor was 1 year junior to me in my college. I gave him a certificate. After 3 months, again CMO came to my hospital, and he told me, let us go to the hospital. I told, he came to my quarter first, then we went to hospital. You find out your admission register. Show me the admission register. I was afraid. I mean, why? What is the problem, sir? Then he told, do you see this person, whether he is admitted? I show, yes, he is admitted. He was discharged ticket, everything. Whenever you write down the admission ticket, you have to, there is a register, admission register, the day, time when he was admitted, and the date, time when he was discharged. You have to understand. So, but I have given a certificate to him, you have given a certificate to him on 7th April, that he is fit for duty on 7th April. But on the same day he joined his Silchar by 7th April. How he could go same day to Silchar? At that time plane service was not there, only bus service was there. He is from Belonia area. So by 1 day from Belonia to Silchar, how he could go? I told, I have given him advance certificate because he wants to join on 7th. I issued it on 7th, but actually I issued him on 5th. Date is given on 7th. You cannot. So the day you discharging, the day you give the certificate, that day you have to mention. Because a person has to go there and join. So it takes a transit period of 2 to 3 days. That period you have to come. But you should not do like that. This is one mistake. Another incident I will tell. One patient was admitted in my hospital, PSC. There was no chowkidar. So, patient left the hospital in the night time, 2 o'clock. Nobody, everybody is sleeping, sister is sleeping, doctor is sleeping in the quarter. He has gone somewhere. He has murdered one person, killed. Came back, slept down, slept. Again, morning, again police came after 2 days. He is the murderer. I told, no, how can it be? He was in bed, Khata is telling he is in bed. Admission register is there, everything is there. The door is opened actually, night time, door is not closed. So there was no collapsible gate. So these are the, and ultimately it was proved that he was jailed also, he killed the person. So these are the incidents I told of my own experience. So issuance of a medical certificate is very careful. Very careful, you must be careful. Advance date, you can, today you are seeing, you can write. Illness. And the day he comes, as for example, you have given 15 days leave, he will go. But he will come after 20 days. Plus, please give me a fitness certificate. Then you will tell, I have given you 15 days leave. But you are coming after 20 days. What will you do? The day he comes, you issue that thing. Then he will tell, give me 5 days more. Don't. Because you do not know these 5 days what he has done. I know one doctor who has given a certificate to a dead person. Son came and told, my father died, please give me a certificate. So he has given a death certificate. Actually, he has not seen anything, depending on the father. Actually, father is not dead. He filed a case for property. The father came later on, I am alive, this is my property. So many things. You should be very careful. These are the experience I am sharing with you. Because your future will be, registration will cancel. If you are not registration is cancelled means you are not a doctor. Every doctor has got a registration. state registration and also MCI registration. So that is important. Technique and untoward drug reaction. It is also very interesting. You have given a drug, they have got a reaction. Well, it may happen. As for example, ibuprofen, ibuprofen is a drug given for pain relief. But you cannot write the drug to a patient having asthmatic bronchitis or asthma, bronchial asthma. You cannot write. So some patients, as for example, once I have got personally pantoprazole allergy. One day I have got some problem, gas, acid, I took pantoprazole. Within 10 minutes, I have got itching of the whole body. I feel discomfort. I feel restless and dyspnea, difficulty in breathing. And I thought I would die. One of our state doctor, I telephoned, came running. So he treated me so well, by 2 hours I could not get up. So untoward drug reaction is very dangerous. Sometimes you can push an injection. Patient may complain, after giving the injection, my patient died. So be careful. Sometimes some drugs we are doing test, skin test, dermatological test before giving injection. There is a very dangerous drug reaction is Stevens-Johnson syndrome. This is my experience. One patient, Ramnagar, the area in Agartala, we were long back, 20 years back, patient has got back pain. Back pain sometimes radiates downwards. So that is called radiculitis or radiculopathy. People will tell you, I've got back pain for 10 days and numbness and tingling of the limbs when I walk. At that time, the drug of choice was carbamazepine. Carbamazepine was the drug of choice. Still now, it is written in many doctors. So it was available in the name of Japtol or Tagretol. Different companies in different. So carbamazepine is the pharmaceutical name. So patient, after writing this medicine, 3 days later, the patient's husband came. Sir, I have got some chicken pox in my body. And I told, you visit a dermatologist, skin specialist. Very famous people, they visited. He told, he did not see. Patient gone there, then he told, yeah, it is chicken pox, it is not chicken pox, it is drug allergy. Don't take the drug, get admission in the hospital. They told, no, it is chicken pox. In chicken pox in village areas, they do Shoni Puja, Odi Puja, Kali Puja, and Shitula Puja and Kali Puja. She started Kali Puja, Shitula Puja, and they have taken all the medicines continued. After 3 to 4 days, patient has got vigorous eruption, tongue, stomach, vagina, everywhere, whole body, bleeding, nose, eyes. They are admitted in the SGMC. At that time, SGMC was not there, it was a GB Pond hospital. So, after that, after patient met me, patient party met me, said, this is the condition, and I have seen the patient, I was afraid, so fearful condition. Next day, when morning I went to see the patient was absent. I asked sisters and doctors, one specialist was sitting, where is the patient gone? But we don't know. I thought that she might have died. So I became more afraid. I completed my MS 3 to 4 years earlier. Then only I knew my practice was good, everything is nice. So in this condition, patient, I was very sick. So after 1 month, party came. They have taken the patient to CMC Vellore. So here also it could happen, blood has been given over here, but they went there, then they are telling that we have given 80 bottles of saline, so many injections, so many here, you have to give me the cost of medicine and transport, everything you have to give me, why you have written this drug? But that was the drug of choice for carbamazepine, but you have to be vigilant to see the drug reaction. So, drugs, they rebuked me anything in my chamber, but I tolerated. I kept mum, handled the matter very silently, very passionately. Patient, party, friends became very good. They both were, this doctor is very good, very silent doctor, did not misbehave with you, but the party misbehaved with me. But other friends are telling, don't do like that. So there are some patient party, they are very good, some are not good. And you should be also vigilant to see the drug reaction. Adverse drug reaction is very dangerous. So when you prescribe, you write, you tell your patient, please inform if there is some adverse. Patient may have, you have written some analgesic. Patient may have malaria, black stool, hematemesis, blood vomiting, might have some gastric ulcer. So you have to be careful. Attending telephone call. So telephone call attendance, as for example, all violence, all the major is there, difficulties are there like drug addiction, you must attend the call. Attending the call in late hours also very important. You do not know who is telephoning, your parents, your son, daughters, or your patients. For our patient is very important. So everything is very important. So, and workplace violence and causes a lack of infrastructure and facility, lack of resource, and your behavior is also important. When somebody rebukes, you have to keep mum. In your family life also, when one person quarrels, another person remains mum, then silent, there will be less quarrel. But he will also, both of them start. So in our hospital also, you just give them, tell the patient, tell them, bhai, ho gaya. It's just calm them down by your cooling words. ठीक है? So it is ending, I think. Oh, now, India lags behind in key health indicators. Conclusion, there is a growing burden of diseases in India. Inadequate poor healthcare planning in rural area and urban area, shortfall of physical infrastructure, all the X-ray machine, MRI and other things, MRI, CT scan, in all hospitals because of the lack of in finance, it is not available. Shortfall of trained manpower, doctors, nurses, paramedics are shortage. So, minuscule healthcare budget, healthcare budget is very less in India. So, high cost of advanced treatment. Any advanced treatment is very high cost. You go to private health sector, very costly treatment. So, low insurance for penetration. Insurance is not there. In foreign countries, Europe and USA go, all are insured. You give, as per a normal delivery takes $45,000-$50,000. $50,000 month you go, multiply by 80, so much. But you are covered with insurance. If you give insurance premium $500 per month, so you will be covered all these. But you have got no insurance means you are gone. In USA and foreign countries you can. You are in England also, everything covered. So insurance, in our sector also insurance is not there. I know one person, he has given only 6,000 rupees, one premium. Yesterday he met me. So 1,000 rupees, 6,000 rupees gave. Suddenly he has got fever. And this fever, after next day, he got dyspnea. He was admitted here. He was referred to CMC, Apollo Chennai. There he stayed. And he came, he spent 26 lakh rupees. And he got it back by insurance. Only 6,000 rupees premium. 26 lakh rupees, and he went to CMC, he stayed there for 3 months. So, insurance for, nowadays government is also, our government is also giving insurance, central government, state government is also giving, and unregulated private sector. So, unregulated means there are many private sector hospitals, very high cost. They are not controlled, uncontrolled by any legal action. You go to somewhere, but my fee is 10,000 rupees. Who is there? So, you must have some control. Government should have some legal action for this thing. So, corporate and not the thing.